Hi, I'm Dr. Sheri Rowen. I'm the Director of Ophthalmology at Mercy Medical Center in Baltimore, Maryland. For many years, I have been interested in treating and helping those with dry eyes. The two known causes for dry eye are 1, aqueous insufficiency, and 2, evaporation. The aqueous insufficiency happens when we don't make enough of the water layer in our eye, and that can occur from inflammation in the eye. The evaporation component can occur because we don't have enough oil layer to the eye. This is the outer layer of the tear film, and it can be either too much or too little or not the right texture, and we have to have a perfect oil layer so that we can see through that oil. It should be like a thin coating like olive oil. And many times our oil glands become clogged and dysfunctional. Dry eyes present with many symptoms, those of irritation, a scratchy sensation, burning, waking people up at night, dry and irritated, and basically many people are fairly miserable because we're really not supposed to detect that our eyes are present. They're supposed to just be there and let us see, but we're not supposed to have any discomfort while we're looking around. We've had many pharmaceutical options to date to treat dry eyes, and they started ranging from lubricants, which are artificial tears, to gels, a thicker artificial tear, and ointments, which are the most thick, and many times we prescribe them in the evening. That helps to coat the eye, make the eye feel better, but it doesn't treat the cause of the dry eye. The next ranges are the anti-inflammatory agents, and we have many of them that we try for the patients that come in the office. We also use essential oils that we add to the diet, and we've tried many of these remedies and the combination, and many people are helped. But still yet, there are a large group of people that can't be helped with these current remedies, and there are new treatment options that are available today. The new option I'm going to discuss is the intense pulse light therapy for dry eye. And this is designed to help restore the normal texture and consistency of the oil layer that you need for your natural tear film. The use of intense pulse light is a new in-office procedure that uses light therapy and oil gland expression with the intent of alleviating inflammation and clogged glands. My good friend and colleague, Dr. Rolando Toyos, has been working diligently over the last 8 years to develop this technique and technology to safely and consistently deliver this therapy for the treatment of dry eyes. With his experience, he has found that 90% of patients report that their symptoms are better, and by clinical exam, they are better. You might ask, who would be a candidate for this procedure? I'll go through a few things. First of all, if you're on multiple drops throughout the day, or multiple remedies of drops, or multiple remedies, period, you could be a candidate for this procedure. If you have rosacea, and your dermatologist has told you that, or if you suspect it because you have red blood vessels on your face, or a little redness to your cheeks, or your nose or your chin, and your eyes are irritated, you could also be a candidate for this procedure. Rosacea is a skin condition that presents with dilated blood vessels throughout the face, the cheeks, the chin, and around the eyelids. They also are patients who have irritated eyelids, such as blepharitis, and meibomianitis, which is the problem of the oil glands. The blood vessels are treated by the intense pulse light therapy because it actually targets blood vessels, and this helps to cut down the inflammation. Also, with the heat of the IPL therapy, the oil glands start opening up and can become unclogged, and with the oil gland expression, we can get the glands working again. So this treatment can help both your complexion and the symptoms of dry eye. I'd like you to understand a little bit about the lids and the oil glands in the lids and how this even works. You can see that there's multiple little spots here. And these spots are actually the openings for the oil glands. They many rows of these oil glands, and the oil comes out into the eye in little droplets all day long. We don't even know it's coming out. But if these oil glands are dysfunctional, it starts becoming blocked right here. And many times we see that the gland, the opening, is completely blocked. So this light therapy warms this up, and then we can express this and get the oil glands opened up and moving again so that the natural oil will be able to go into the eye in a normal quantity. If you would like more in-depth understanding and information, you can visit Dr. Toyos' website at www.dryeyenews.com, and you can watch videos explaining the development of this procedure and patient testimonials. If you would like a consultation, please feel free to call my office at 410-332-9500, and we would be happy to arrange a consultation in one of our many Maryland locations.